Hey guys, how you all doing? Okay, so today let's talk psychology, shall we? Okay, when a person feels a degree of shyness, I'm sure that every one of us at some point in our lives have been shy about something, or probably we find ourselves in a gathering or with some unfamiliar people and all of that. We tend to probably feel awkward or tensed or worried. That's what shyness is, and I'm sure each and every one of us has gone through that stage, like at one point in our lives. Yeah, that's shyness. But when this thing becomes like a constant thing, like something that happens like almost all locations to a person, then the person might probably be suffering from avoidant personality disorder. Okay, so what is avoidant personality disorder? When a person has avoidant personality disorder, he or she would almost on like every occasion like want to refrain from any social encounter. Like he or she just doesn't want to be in any form of social gathering or any form of encounter with people. Like he refrain totally into himself, into his own world, away totally from other people, from any kind of relationship. Like they just want to be by themselves. They don't want to have anything to do with people. They just want to do things their own way. People suffering from avoidance personality disorder, they don't want to have anything to do with people, and this kind of like affects them. It affects their entire being, right from like their relationship, their academics and all of that. Because when you have avoidance personality disorder, how are you going to, no one is an island. So like you need people, you need to relate with people, share knowledge with people, share ideas with people. That's how you get better. So when a person suffering from avoidance personality disorder is exhibiting those kind of symptoms and all of that, doesn't want to talk to anybody, how is the person going to keep learning? No one is an island of knowledge. We need people to continue learning and all of that. So yeah, it affects them academically, it affects them relationship wise, friendship wise. Like they just don't know how to hold a relationship. Like they suffer when it comes to relationship, because it's not like they really want to. It's not like they don't want to. In fact, it kills them every day of their life that they're not able to do the simplest things that people do, like have relationship, have friendships, and all of that. So like it kills them inside that they're not able to do all of that. It's not for lack of trying or anything. It's just it is what it is, and it is a disorder. It's not really their fault, but it's based off of all the things they have concocted in their head, all the imaginations they have going on in their head about how they are socially inferior to other people, and how people are out to like embarrass them and make them feel unworthy. So like they tend to, like, based off of the things that they've imagined and all of that, they tend to avoid any situation whatsoever that would bring all of their imagination to reality. They tend to avoid any kind of situation that will make them feel insulted, rejected, embarrassed, or whatnot. So like frame into themselves, into their shell, they tend to be loners. And those people like that are suffering from that kind of personality disorder, they take up jobs that doesn't necessarily have to, involve other people. Like they take up jobs that they can do alone by themselves without involving other people. So that's the kind of job they look for. That's the kind of job they get themselves involved with. And most of them don't really have, they don't do well when it comes to relationship. Like I said earlier, like they have issues when it comes to relationship. Because when you are always like envisaging that someone is out to insult you, embarrass you, even the slightest form of remark, any kind of remark whatsoever, might be tagged as insult. Like it might be misconstrued. It can be mistaken for criticism, for embarrassment and all of that. So they would definitely keep on having issues with their partners. Because when you're like, if I say something that don't mean it to be embarrassing, or I don't mean it as any form of criticism, and you are there taking it like that's what I'm actually doing, it will keep causing fights and quarrel, and that kind of relationship will never thrive. So like they they hardly get into relationship. And when they get into really go into any kind of relationship, they go into relationships that they would feel safe. They would feel like um they're good enough. Literally relationship that would they will feel completely accepted. Like there will be this unconditional acceptance from their partner. That's the only time that they go into relationship. And even at that, even when they are opportune to find a partner that would accept them like unconditionally and all of that, they will always like be on edge. They will always envisage. And when you're constantly envisaging something, you're constantly on edge, on your toes and expecting something. Definitely that kind of relationship is not, it's toxic. That is not a, that is not a healthy kind of relationship. So sooner or later their partners or whatnot would get tired of them and will walk. So like they hardly can hold any kind of relationship, be it friendship or whatever. They can hardly hold any kind of relationship at all. Avoiding personality disorder shares some kind of similarities with schizoid personality disorder. That's like all those people that have schizophrenia, that's what we call schizoid personality disorder. So like they share some kind of similarities, but in the situation of schizoid personality disorder, I don't want to go much into that, but people suffering from schizoid personality disorder, they don't feel any desire to have any kind of relationship with anybody. So I don't know if you get the difference. Avoidance personality disorder, they feel the desire to forge relationships, friendship, emotional relationship and all of that. But they just don't know how to, because they have all this thing going on in their head. But in the case of suicide personality disorder, they don't have that desire. They don't feel it. They don't even want to. They don't want to try. Like they just want to like be by themselves and not have any relationship with anybody whatsoever. So that's the difference between schizoid and audience personality disorder. Like even though they share some similarities and all of that, they are completely different. Study has it that avoidance personality disorder is more prevalent, is more common in children whose parents as or are suffering from schizophrenia. Like if probably like a person has a parent that is suffering from schizophrenia, there's a high probability, a high possibility that that person might, develop or develop avoidance personality disorder. According to Sheldon and West 1990, contemporary psychodynamic of disorder, it emphasized the person suffering from avoidance personality disorder attachment. Like they have this fear of attaching to anybody whatsoever. How the cognitive behavioral approaches regard the individual as hypersensitive to rejection due to a severe lack of parental concern. Like it can be traced to the fact that their parents like probably have zero concern about them while growing up, like rejected, like they suffer rejection and feel unwanted. They were made to feel unwanted by their parents. Like I don't know how that could happen, but it could be due to different kind of circumstances. Maybe the parents have this busy jobs, busy schedule and all of that, and completely forget about the child they have. So like in situations like that, children that goes through that kind of rejection and lack of concern while growing up tend to grow up with and develop avoidance personality disorder. So according to this approach, the dysfunctional attitudes that those people have going on is due to all of those things that they have in their head. Like they have it in their head that they are socially inferior to other people. So they don't want anything that will bring them insult and embarrassment. So Having that at the back of their mind and having that going on in their head, they tend to like, you know, withdraw completely from the whole world. How can this personality disorder be treated? Cognitive behavioral therapy is the way to go for treating people with avoidance personality disorder. So, what do I mean by cognitive behavioral therapy? Cognitive behavioral therapy it helps the client to articulate their dysfunctional thoughts, all those thoughts going on in their head, all those dysfunctional attitude, all those dysfunctional thoughts going on in their head and interfering with their interpersonal relationship. Like they help them come to terms with those irrational beliefs. But this is done in a very, safe atmosphere in like a counseling session or a therapy session and all of that. It can't just be done anywhere or by any person. It has to be done by a professional, by a therapist, or by a counselor. That kind of intervention can only be possible when the clients completely trust the therapist. In a situation whereby, and they don't trust easily, they don't go close to people that easily, so like it takes a lot of patience from the therapist, from the counselor, to get through to the person suffering from this disorder. Like it takes a whole lot of patience. Like, yes, the counselor, the therapist is a professional. He or she has gone through a lot of process, a lot of drilling, have a lot of experience when it comes to dealing with people with different kind of personality disorder. But when it comes to this particular personality disorder, the counselor or the therapist have to like have a whole lot of patience when it comes to dealing with them, because the therapy has to get the client to trust him or her, if like trusting her before intervention can work. So if the client doesn't trust the therapist, there's no way the therapist can get through to the client, and the client will just have to, there won't be any recorded progress, so to say. The treatment prognosis of this intervention is poor, in the sense that those people are very sensitive human beings. They tag the slightest remark, the slightest talk, or the slightest conversation as embarrassing and insulting and all of that. So like a therapist can just say something and it can be misconstrued anytime, any day, and that could bring a problem between the client and the therapist, because they might feel embarrassed and they might not want to continue the therapy session, thereby making the whole thing just a waste of precious time. So, like the counselor and the therapist, they have to be like really patient when it comes to people like that for that kind of intervention to be successful. So, if you have people, exhibiting this kind of symptoms, be patient with them. It's not really their fault. It's not their fault at all. They are just different. So like be really patient with them, and take things easy with them, show them love, show them unconditional acceptance. And if you're a parent and you have a child that has this kind of personality disorder, all you need to do is get him or her the necessary help that he or she needs. And in the meantime, while the intervention is going on, try as much as possible to show them love. Don't talk down on them, don't insult them, don't make them feel embarrassed. Show them like unconditional love and acceptance, and with time they'll be fine. So yeah, that brings us to the end of today's talk about psychology. So if you like this video, if you've learned one or two things about this video, please give this video a thumbs up and subscribe to my channel for more psychological talks. I'll be seeing you in my next one. Love ya.